12 weird signs that you have liver damage. Does your body also remain tired throughout the day, or there is swelling in your legs, or there is pain in the right side of your abdomen, or your stool is dark yellow in color? Then these could be signs of liver damage. The liver is a big organ under your ribs on the right side of your belly. It can be as heavy as 4 pounds. The liver helps your body digest food, get rid of waste, and make stuff that helps your blood clot. Liver problems can come from family history, viruses, drinking too much alcohol, or being overweight. If the liver gets damaged a lot, it can cause a condition called cirrhosis, where it gets scarred. In this video, we will see 12 signs of liver damage, and the last sign is very important, so watch the video till the end and do like, share the video, and subscribe to the channel. Let's start with sign number first. Fatigue. Fatigue is one of the most common yet non-specific signs of liver damage. It can manifest as a general feeling of tiredness and exhaustion that persists even after getting enough sleep. This fatigue can significantly impact your daily life, making it difficult to concentrate at work, complete chores around the house, or even enjoy leisure activities. There are a couple of reasons why liver damage can cause fatigue. First, the liver plays a crucial role in processing nutrients from food and converting them into energy. When the liver is damaged, its ability to perform these functions can become impaired, leading to a lack of readily available energy for your body. Additionally, liver damage can disrupt the production of certain hormones and proteins, including those involved in regulating sleep and metabolism. This disruption can lead to disturbed sleep patterns and a reduced metabolic rate, both of which can further contribute to fatigue. It's important to remember that fatigue can be caused by many other factors, such as stress, anxiety, depression, or even lack of sleep itself. However, if you're experiencing unexplained fatigue that is persistent and accompanied by other symptoms like nausea, loss of appetite, or abdominal pain, it's important to see your doctor to rule out any underlying liver problems. Sign number second is nausea. Nausea and vomiting are unpleasant symptoms that can significantly disrupt your daily life. They can be caused by a variety of factors, but in the case of liver damage, they occur due to the liver's compromised ability to process toxins and waste products in the body. When the liver is functioning properly, it efficiently filters toxins and removes them from the bloodstream. However, when liver damage is present, these toxins can build up in the bloodstream and irritate the digestive system. This irritation triggers the nausea reflex, leading to that feeling of unease and disgust. In some cases, the irritation can be severe enough to trigger the vomiting reflex as the body tries to expel the perceived toxins. The nausea and vomiting associated with liver damage can vary in frequency and severity. Sometimes it might be a mild feeling of nausea that comes and goes, while other times it might be persistent and lead to forceful vomiting. The specific characteristics can depend on the underlying cause and extent of the liver damage. Sign number third is loss of appetite. Loss of appetite, medically known as anorexia, is a frequent symptom in individuals with liver damage. It can be a significant cause for concern, especially if accompanied by other signs. While a lack of hunger can arise from various reasons, a malfunctioning liver disrupts processes that directly influence your desire to eat. The liver plays a crucial role in several functions related to appetite regulation. Here's how liver damage can contribute to loss of appetite. Disrupted hormone production. The liver produces hormones like leptin, which signals satiety, feeling full, and ghrelin, which stimulates hunger. When the liver is compromised, this delicate hormonal balance can be disrupted, leading to decreased ghrelin production and a diminished urge to eat. Impaired digestion and nutrient processing. A healthy liver secretes bile, a substance that aids in fat digestion and nutrient absorption. Liver damage can hinder bile production, causing indigestion, bloating, and discomfort after eating. This negative association with food can lead to a conditioned aversion and loss of appetite. Inflammation and fatigue. Liver damage often triggers inflammation throughout the body. This inflammatory response can lead to a general feeling of malaise and fatigue, making the thought of eating unappealing. Altered taste perception. In some cases, liver damage can affect taste buds, leading to a distorted sense of taste, or even a metallic taste in the mouth. This can make food unappetizing and discourage eating. Sign number 4 is abdominal pain. Abdominal pain is a common symptom, but its location and characteristics can offer clues about the underlying cause. In the case of liver damage, abdominal pain can manifest in several ways. Location. The pain is typically felt in the upper right portion of your abdomen, just below the lower right ribs where the liver is situated. Intensity. The pain can range from a dull ache to a sharp, stabbing sensation. It might be constant or come and go. Aggravating factors. The pain may worsen with certain activities, such as coughing, deep breathing, or pressing on the area. The specific reason for abdominal pain in liver disease can vary depending on the cause of the damage. For instance, inflammation. If the liver is inflamed due to hepatitis or other conditions, the capsule surrounding the liver can become irritated, leading to pain. Enlarged liver. As the liver becomes damaged and inflamed, it can grow larger, stretching its capsule and causing discomfort. Ascites. Liver disease can lead to a buildup of fluid in the abdomen, ascites. This excess fluid can put pressure on the organs in the abdomen, including the liver itself, causing pain. If you're experiencing abdominal pain in the upper right side of your abdomen, especially if it's accompanied by other symptoms like fatigue, nausea, or jaundice, it's important to see your doctor to determine the cause and get prompt treatment. Sign number 5 is jaundice. Jaundice, the telltale sign of your liver struggling to function properly, arises from a buildup of bilirubin in the bloodstream. Bilirubin is a yellowish pigment produced naturally during the breakdown of red blood cells. Normally, your liver filters bilirubin from your blood, conjugates it, makes it water-soluble, and excretes it into your bile. Bile then travels to your intestines and exits your body through your stool. However, when your liver is damaged or diseased, this process gets disrupted. The liver may not be able to efficiently remove bilirubin from the blood, or there may be problems with bile flow. This leads to excess bilirubin accumulating in the blood, causing a domino effect. As bilirubin levels rise, they start to seep into your tissues, particularly those rich in fat, like your skin and the whites of your eyes. This infiltration of bilirubin is what triggers the characteristic yellowing associated with jaundice. The severity of the yellowing can vary depending on the bilirubin levels. In mild cases, the yellowing might be subtle, particularly in people with darker skin tones. But as bilirubin levels climb, the yellow color becomes more pronounced and can take on a deeper greenish-yellow hue. This discoloration is most noticeable in the whites of the eyes, sclera, and on the soft tissues of the body, like the palms, soles, and underneath the tongue. Sign number 6 is dark urine and pale stools. Changes in your urine and stool color can be a telltale sign that something is amiss with your liver function. Normally, bile produced by the liver plays a crucial role in digestion. Bile pigments, a byproduct of bilirubin breakdown, contribute to the characteristic brown color of your stool. When the liver is damaged or bile flow is obstructed, several issues arise. Excess bilirubin in the blood. A damaged liver struggles to process bilirubin, leading to a buildup in the bloodstream. This excess bilirubin spills over into the urine, causing it to take on a dark yellow or even brown color. Lack of bile pigments in the stool. Since bile isn't reaching the intestines as efficiently, there's less pigment available to color your stool. This results in pale or clay-colored stools. The combination of dark urine and pale stools is a red flag that warrants a visit to your doctor. It can indicate various liver problems, including hepatitis. Viral infections like hepatitis A, B, or C can inflame the liver, affecting bile flow. Cirrhosis. Scarring of the liver tissue due to chronic liver disease can impede bile flow. Gallstones. Stones lodged in the bile ducts can block the passage of bile. Autoimmune hepatitis. The immune system mistakenly attacks the liver, causing inflammation and potentially bile flow issues. Sign number 7 is itchy skin. Itchy skin, also known medically as pruritus, can be a particularly bothersome symptom of liver damage, especially in conditions affecting bile flow. The liver produces bile, a fluid that helps digest fats in the intestine. In healthy individuals, bile flows from the liver to the gallbladder and then into the small intestine. However, with liver damage, bile flow can become sluggish or blocked entirely. This can lead to a buildup of bile salts in the bloodstream. These bile salts can deposit themselves under the skin, triggering intense itching sensations. The itch can be localized to certain areas, particularly the palms of the hands and soles of the feet, or it can be generalized all over the body. The severity of itching can vary greatly, but it often intensifies at night, making sleep difficult. While the exact reason why bile salts cause itching isn't fully understood, it's believed to irritate nerve receptors in the skin. It's important to note that not everyone with liver damage experiences itching, and itching can also be caused by many other conditions besides liver problems. Sign number 8 is easy bruising and bleeding. One of the telltale signs of potential liver damage is a tendency to bruise and bleed easily. This occurs because the liver plays a crucial role in blood clotting. It produces proteins called clotting factors, which are essential for forming clots and stopping bleeding after an injury. When the liver is damaged, its ability to produce these clotting factors can become impaired. This reduces the blood's clotting ability, making even minor bumps or scrapes result in noticeable bruises. Additionally, you might experience more frequent nosebleeds or bleeding gums. In severe cases, internal bleeding can also occur. Easy bruising and bleeding shouldn't be ignored. While it can sometimes be caused by other factors like certain medications or vitamin deficiencies, it's important to seek medical attention to determine the underlying cause. Early diagnosis and treatment of liver damage can help prevent further complications, including excessive blood loss from injuries or even internal bleeding episodes. Sign number 9 is spider angiomas. Spider angiomas. These aren't the creepy crawlies you might expect. Spider angiomas, also known as spider nevi, are small, harmless, vascular lesions, collections of dilated blood vessels that appear just beneath the skin's surface. They live up to their name by resembling a spider, a central red spot, like the spider's body, with thin red lines radiating outward like spider legs. These tend to be quite small, ranging from 1 to 10 millimeters in diameter. While spider angiomas are typically painless and pose no threat to your health, they can be a cause for concern if you have multiple ones, more than 3. This can sometimes be linked to underlying liver conditions like cirrhosis or hepatitis C. If you have these and are concerned about your liver health, a doctor can perform tests to rule out any underlying issues. It's important to note that spider angiomas can also appear during pregnancy due to hormonal changes and usually fade away on their own after childbirth. Similarly, they can surface in people using oral contraceptives and disappear once discontinued. Sign number 10 is fluid retention. Fluid retention, also known as edema, is a condition where excess fluid builds up in the body's tissues. This can manifest as swelling, most commonly in the ankles, legs, and feet, but also occasionally in the abdomen, belly. In the case of liver damage, fluid retention is a consequence of the liver's impaired ability to perform its balancing act of fluids in the body. Normally, the liver produces proteins, called albumins, that help keep fluids within the bloodstream. When the liver is damaged, albumin production decreases. This allows fluids to leak out of the blood vessels and accumulate in surrounding tissues, causing swelling. There are 2 main reasons why liver damage can lead to fluid retention. 1. Portal hypertension. Cirrhosis, a severe form of liver damage, causes scarring that hinders blood flow through the liver. This increases pressure in a vein called the portal vein, which carries blood from the intestines to the liver. The increased pressure forces fluids out of the blood vessels and into the abdomen. 2. Decreased albumin production. As mentioned earlier, a healthy liver produces albumin, a protein that keeps fluids within the blood vessels. When liver function is impaired, albumin production goes down. This allows fluids to seep out of the bloodstream and contribute to swelling. Sign number 11th is confusion and forgetfulness. Confusion and forgetfulness can be frustrating to experience, and while they're often associated with normal aging or stress, they can also be a red flag for underlying liver problems. This is due to a condition called hepatic encephalopathy, HE. Normally, your liver acts as a filter, removing toxins from your bloodstream. When your liver is damaged, these toxins can build up and reach your brain. Ammonia, a particularly harmful toxin, disrupts brain function, leading to symptoms like confusion, forgetfulness, difficulty concentrating, and even slurred speech. The severity of confusion and forgetfulness can vary depending on the extent of liver damage. In mild cases, you might experience forgetfulness with everyday tasks or have trouble focusing for extended periods. As the condition worsens, confusion can become more pronounced, leading to disorientation, personality changes, and even sleepiness. If you're experiencing any degree of confusion or forgetfulness, especially if it's accompanied by other symptoms like fatigue, nausea, or jaundice, it's crucial to see your doctor. Remember, confusion and forgetfulness shouldn't be dismissed as just a normal part of life. By seeking medical attention, you can address the root cause and improve your overall health and well-being. Sign number 12th is redness or palmar erythema, redness on the palms of hands, palmar erythema. This is a less common sign of liver damage, but it can be a telltale indicator, especially in cases of advanced liver disease like cirrhosis. Palmar erythema presents as redness in the palms, usually concentrated on the fleshy thenar eminence at the base of the thumb. It may affect both palms and sometimes extend to the soles of the feet, plantar erythema. The reddened areas might feel warm to the touch, but they typically aren't itchy or painful. Experts aren't entirely sure why this redness occurs in liver disease, but it's believed to be related to hormonal changes and abnormal blood vessel function. The liver plays a crucial role in metabolizing hormones, and imbalances caused by liver damage can lead to increased estrogen levels. Estrogen is known to cause vasodilation, or widening of blood vessels, which could explain the redness in the palms. Additionally, liver disease can disrupt blood flow and impair circulation, further contributing to the reddened appearance. While palmar erythema can be a sign of liver trouble, it's important to note that it has other causes as well. Pregnancy, hormonal therapy medications, and certain autoimmune diseases can also cause redness in the palms. Now we will learn about 3 natural herbs that can reverse your liver damage. While there is no magic bullet for reversing liver damage, several natural herbs have shown promise in supporting liver health. Here are 3 of the most studied. 1. Milk thistle. Milk thistle has been used for centuries to treat liver ailments. It contains silymarin, a group of antioxidants that are thought to protect liver cells from damage and promote regeneration. Studies suggest that milk thistle may be helpful in improving liver function in people with non-alcoholic fatty liver disease, NAFLD. 2. Turmeric. Turmeric, the bright yellow spice commonly found in curries, contains curcumin, a powerful anti-inflammatory and antioxidant compound. Curcumin is believed to protect the liver from damage caused by toxins, inflammation, and oxidative stress. Studies have shown that turmeric may help improve liver function in people with NAFLD and other liver diseases. 3. Dandelion root. Dandelion root is a traditional remedy for liver problems. It contains a variety of compounds, including chicoric acid and taraxasterol, which are thought to stimulate bile production and detoxification. Dandelion root may also help reduce inflammation and protect the liver from damage. If you see any of the 12 signs of liver damage mentioned in the video in your body, then definitely consult your doctor. And if you like this video, then like and share the video and subscribe to the channel and stay connected with our channel so that you keep getting health-related content.